Hello everyone. Welcome to another video on our channel. Today, we're going to talk about a topic that could change your perception of medication and health. Did you know that the heart, one of our most vital organs, could be silently suffering due to some medications we take daily? Cardiovascular diseases continue to be the leading cause of death worldwide, and we often don't realize that simple habits, or even some common medications, can accelerate the aging of our heart and deteriorate our quality of life. Many of us know the classic risk factors for heart disease: diabetes, obesity, a sedentary lifestyle, smoking, among others. But what few people know is that certain common medications can also pose a threat to our heart. In today's video, we will explore 5 types of medications that, when used for a prolonged period or inappropriately, can worsen cardiovascular problems and even put your life at risk. Introduction to medications that affect the heart. Many medications we use to treat conditions like chronic pain, allergies, gastrointestinal disorders, or even cancer can have significant side effects on the cardiovascular system. Chronic use, or the combination of several of these medications, a practice known as polypharmacy, can increase risks, especially in elderly patients with multiple chronic diseases. But how do these medications affect the heart? We will detail each of them below. It's important to note that many adverse effects on the heart can be underdiagnosed because the symptoms often resemble the patient's pre-existing conditions, such as fatigue, shortness of breath, or leg swelling. This can lead to a vicious cycle where new medications are added to treat these symptoms, further increasing the risk of interactions and complications. Therefore, a careful medication review with regular assessments of the medications in use is essential to minimize cardiovascular health risks. Impact of polypharmacy. Studies show that up to 30% of patients with heart failure are at risk due to drug interactions. These interactions can lead to complications such as arrhythmias, heart decompensation, and even congestive heart failure. Based on this information, let's understand which medications deserve more attention. Furthermore, polypharmacy can lead to an increase in the number of hospitalizations and length of stay due to adverse events, directly impacting patients' quality of life and generating additional costs for the healthcare system. Patients on multiple medications often face challenges in adhering to the medication regimen, which can result in inappropriate medication use and increased chances of adverse events. Therefore, strategies to simplify drug therapy, such as regular prescription reviews and the use of combination medications when appropriate, are crucial to reducing these risks. List of 5 medications and their cardiac effects. Number 1. Nasal decongestants. Let's start with nasal decongestants like pseudoephedrine and phenylephrine. These medications are common in treatments for colds and allergies, but they have a dark side. They can increase blood pressure and trigger arrhythmias. For those who already have heart problems, the risk is even higher. Imagine someone with heart failure using these decongestants regularly. It could be a recipe for disaster. A safer alternative: saline-based nasal sprays that don't carry the same risks. Moreover, studies indicate that continuous use of decongestants can lead to chronic hypertension, especially in patients with a history of heart problems. The vasoconstriction caused by these medications reduces the caliber of blood vessels, increasing peripheral resistance and forcing the heart to work harder. This can accelerate the wear and tear on the heart muscle and worsen pre-existing conditions. In severe cases, improper use of decongestants can even precipitate a hypertensive crisis or trigger events like a myocardial infarction. Therefore, it is essential to always seek safer alternatives and limit the use of these medications. Number 2. Nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs such as ibuprofen, naproxen, and diclofenac are widely used to relieve pain and inflammation. However, their continuous use can lead to increased blood pressure and fluid retention, worsening heart failure. Additionally, these medications can interfere with other essential medications for heart disease management, creating a domino effect of complications. Therefore, it is crucial for patients with heart diseases to use these medications cautiously and always under medical supervision. A published study revealed that prolonged use of NSAIDs could increase the risk of an adverse cardiovascular event, such as a heart attack or stroke, by up to 20%. Moreover, NSAIDs can reduce the effectiveness of diuretics and blood pressure medications, such as ACE inhibitors and angiotensin receptor blockers, further complicating hypertension management. For those who cannot avoid NSAID use, regular medical follow-up and medication adjustments are essential to minimize cardiovascular risks. Number 3. Medications for cancer treatment, chemotherapeutics. The fight against cancer is already challenging enough without mentioning the side effects of chemotherapeutic drugs. Medications like anthracyclines, e.g. doxorubicin, are known for their cardiotoxicity. Patients can develop heart failure as a direct result of the treatment. Here, regular cardiac monitoring during treatment is vital to prevent long-term damage. Continuous dialogue with the oncologist and cardiologist can make all the difference. In addition to anthracyclines, other chemotherapy drugs, such as trastuzumab, used in breast cancer treatment, are also associated with cardiac risks, particularly in patients who already have cardiovascular risk factors. Studies show that combining different types of chemotherapy can significantly increase the incidence of heart failure and other heart problems. To mitigate these effects, strategies such as the use of cardioprotective drugs, adjustments in chemotherapy doses, and rigorous cardiac monitoring should be adopted from the start of cancer treatment. Number 4. Stimulants, such as ADHD medications. Stimulant medications, such as those used to treat ADHD, attention deficit hyperactivity disorder, including methylphenidate and amphetamines, are also on the list of drugs that can be dangerous to the heart. They are known to increase heart rate and blood pressure, which can be especially problematic for individuals predisposed to heart disease or hypertension. For these patients, discussing therapeutic alternatives with the doctor is essential. Moreover, a recent study highlighted that prolonged stimulant use in adults might be associated with an increased incidence of adverse cardiac events, such as arrhythmias and even heart attacks. In children and adolescents, long-term effects are still under study, but there are concerns about the impact on cardiovascular development. Therefore, the use of these medications should be carefully evaluated and monitored, especially in patients with other cardiovascular risk factors. Alternatives such as behavioral therapies and non-stimulant medications can be explored to minimize these risks. Number 5. Proton pump inhibitors (PPIs). PPIs like omeprazole and pantoprazole are commonly used to treat acid reflux and gastric ulcers. However, recent studies suggest that prolonged use of these medications may be associated with an increased risk of cardiovascular events, such as heart attacks. Furthermore, PPIs can reduce the effectiveness of some heart disease medications, like clopidogrel, further increasing risks. Therefore, it is crucial for patients who need these medications long-term to do so under careful medical supervision. Recently, research has suggested that prolonged use of PPIs can lead to an increased risk of arterial calcification, a process that hardens the arteries and hinders blood flow. This adverse effect can be particularly harmful to elderly patients or those with a history of atherosclerosis. Additionally, reduced magnesium absorption, a consequence of prolonged PPI use, can affect heart rhythm, leading to arrhythmias. Therefore, it is recommended that patients on prolonged PPI use have regular checkups and consider alternatives such as H2 blockers, especially if they have other cardiovascular risk factors. As we have seen, medications that many consider safe or harmless can have significant impacts on heart health, especially when used for long periods or in combination with other medications. If you or someone you know regularly uses any of these medications, talk to a healthcare professional. Never stop or change a treatment without medical guidance. Additionally, it is essential to adopt a healthy lifestyle as a complement to drug therapy. This includes regular physical activity, a balanced diet rich in fruits, vegetables, and whole grains, and avoiding excessive alcohol consumption and tobacco exposure. Small changes in daily life can have a significant impact on heart health, reducing the need for potentially harmful medications in the long term. Always stay informed about the effects of the medications you take and actively participate in decisions about your treatment together with your doctor. Did you like the content? Don't forget to subscribe to the channel, leave your like, and share this video with friends and family. Let's spread knowledge about health together and help protect everyone's heart.